Good evening, all. Welcome to Edu Skills.
Good evening,
family.
Priya.
Good evening.
Yeah. So, welcome to Edu Skills International OET MEDC. So, today we will see about the listening part A. Let me share my screen. As you all know, we have 4 subtests in OET. That is, and the first subtest is listening. So, in the listening part A, we will be having 24 questions. That means two conversations with patient. One will be with any medical professional and with the patient. So we will be aiming for the band A. So we will see the exam format. So patient-led dialogue. So mainly the health professional will be leading the dialogue and patient will be speaking, and most of the answers will be coming from the patient mouth only. So always be careful with while patient speaks. And before we start the each section, we will be having 30 seconds to read the 12 questions. So that 30 seconds, we will call it as a golden seconds to predict our answers. We will predict the answers with the first method. I think all will be aware about the first method. And write the exact word or phrase as given in the audio. We are not permitted to change any words. We should write exact word. And beware of paraphrasing in the question statement, because they will be using synonyms or synonymous language. The note will be in the formal language, but patient will be speaking in the informal language. That means patient will be using the layman's language. So beware of the paraphrasing. Any idea about the spelling mistakes? Minor spelling mistakes are allowed, but always careful that the normal words, means usually we use the words like paracetamol, vegetables, or hypertension, blood pressure. All those words we use frequently. So whichever words we use frequently, the spelling mistakes if we are making, that will be penalized. So always be careful that don't make any spelling mistake. But sometimes minor spelling mistakes will be all right without there is no differentiation, no difference in the meaning and pronunciation, means it will be all right. And in the B part, there will be 3 possible answers. So we will be the choose the best answer according to the audio. But today we will speak about the listening part A. And for the listening part A, we will be having the 30 seconds to predict our answers. So during the section, we can think. During while seeing the context, we can just imagine what will be they are speaking. If one dermatologist is speaking to the patient, means just we can imagine what will be the condition. If endocrinologist means just we can think. And always keep in mind that the word will be paraphrased or the sentence will be paraphrased in the note, and the patient will be speaking other things. So always beware of paraphrasing and also synonyms. And sometimes they will use some collective words. So just listen for that also carefully, like limbs, birds, etc. So what we are listening for? We will be listening for scales or synonyms language, and there will be paraphrasing of the sentences. The modal verb that will help us to adjust, and some chronological expressions or time expressions, and contrast words. So listening part A. There will be 2 extracts, that means mostly 2 consultations, and 12 marks for each. Part A, 24 questions, so 24 marks. In the part B and C, 18 marks. Total 42 questions and 42 marks. So conversation between a patient and a health professional. So we will see the listening strategies. First, look at the context. Context will give an idea about what they will be speaking. So today we will see an example. So today we are seeing you hear a consultant endocrinologist talking to a patient called Sarah Croft. So what is the context here? Here it is a endocrinologist is talking to the patient. So for questions 1 to 12, complete the notes with a word or a short phrase. So they are giving clearly, they are giving the introduction. We have to complete the notes with a word or short phrase. There will be filling the blanks. So we should write exact word or exact phrase. And you have 30 seconds to look at the notes. And they will be having 30 seconds. I hope everyone will be having a pen or pencil and paper with you. So please take your paper and pencil so we can practice together. See, this is a note we will get, and we see the context. Endocrinologist is talking to patient named Sarah Croft. And there will be some side heading. See here, patient name they have given, and there is medical history and general symptoms, dermatological symptoms, psychological symptoms, and recommended test. So there will be some side headings like or subheadings. So that also we will be careful while reading. So we'll get an idea while reading. Symptoms means we can think, okay, that can be the symptom. Okay, we will be having some idea what they are going to speak. Is they are going to speak about the names of some symptoms or any other symptoms. So most of the times they will be using the nouns, and sometimes there will be verbs or adjectives also. Most of the time, the nouns will be the answer. So just we will listen. If we are getting an idea what they are going to speak, so we can listen for that word. So I hope everybody is ready with the pen and paper.
Yes, we are ready.
Yeah, okay, thank you. And whenever we go through a note, patient note, just see the word before and after the filling the blanks. There will be answer, we have to fill the blanks. So before the answer, before the blank, the word we have to, it's better to underline the before and after the words. See, here the patient name is Sarah Croft. The medical history, hypertension, recently worsened. 3 years of corticosteroid treatment for. So we will underline the treatment for the first question. Then they are giving the subheading, that is general symptoms. See, they are telling gradual weight gain, especially in stomach area, and next on face. So we will be underlining the on face, and next visible dash between the shoulders. So before the blank visible and after between the shoulders. Next, swollen ankles, excessive and constant something. They are going to tell something about. And backache periods are. Then, so before and after the blanks, we have to underline and we try to understand. So medical history, they are telling 3 years of corticosteroid treatment for, that can be a disease. The patient will be taking treatment for a disease. So that will be a noun. And next, general symptoms. Under that, they are telling the symptoms. So symptoms, most of the time symptoms will be name of the symptoms. So gradual weight gain, they are mentioning, especially in stomach area, and a dash on face. So there will be something on the face, and a visible dash on between the shoulders. So there will be symptoms. Symptoms means most of the time it will be coming as a noun. But here, see, excessive and constant. That means adjective. They are explaining the characteristics of the symptoms. So that can be a so just listen for that. The dermatological symptoms, question number 6, tendency to dash. That also symptoms. The heading is speaking about the symptoms. So whenever we listen to audio, just they will be giving in an introduction. So we will see about something. They will be giving an introduction. So we will be carefully. We should listen for that. So tendency to dash. So that also some symptoms. They will be telling something. So we will listen for a name or some symptoms. Name of some symptoms. And wounds slow to heal and dash on thighs. So some symptom is present on the area, and next recent development of something. And psychological symptoms, that also patient is mildly depressed, scared by new experience of some symptoms. They will tell, patient will be speaking about some symptoms and feels constantly something. So recommend test, and that also can be a noun, the name of a test. So now we'll go through the audio. Let me start the audio.
Occupational English Test. Practice Test 2. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1. Extract 1, questions 1 to 12. You hear a consultant endocrinologist talking to a patient called Sarah Croft. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Just go through the notes and then understand the keywords.
Good morning, Mrs. Croft. I see your GP has referred you to me.
Yes.
OK. Well, I've got some notes here with his referral letter, but it'd be helpful if you could tell me in your own words the sort of problems you've been experiencing.
OK, well, I've had high blood pressure for several years, but these last few months that's tending to get worse. I've been on corticosteroids too these last 3 years or so, and that's a result of the fact that I've suffered from asthma since my teens.
I see. But I understand you've developed several other problems recently.
Oh, yeah. As you can see, my stomach is huge. I've put on a lot of weight and it seems to be concentrated there. And, oh dear, I don't know what's happened to my face. All this hair which has appeared, it's so embarrassing. And something else which I didn't notice at first, but which other people have pointed out to me, here, see, in between my shoulders, is this, well, I can only describe it as a hump. That really bothers me too.
Yes, I can see.
And look at my ankles, you know, they're swollen too. Something else which has got really bad is that I'm also sweating so much, even in cold weather. No amount of antiperspirant seems to help.
Yeah, that must be difficult. And any aches or pains?
Well, my back tends to ache a bit, but I take ibuprofen, which helps.
Good.
My periods used to be painful in the past, but to be honest, they're so infrequent now that the pain really isn't a problem anymore. I often feel tired, though. In fact, like really tired.
And what about your skin?
Oh, yeah. It seems to bruise at the slightest thing. And I've noticed that if I get a cut or a scratch or something, it takes ages to heal. And something else I've spotted on my thighs, see here is these stretch marks.
Ah, yes.
They're quite noticeable because they're a real purple colour. My face has changed too. I used to have quite pale skin, but as you can see, it's quite red now. And it looks, well, puffy. I mean, it never used to look like that.
OK, so there's been quite a change.
Oh, definitely. And if you look here on my neck, the skin's gone dark. Really odd. I don't know what's happening. And though I never really had it before, I've now got acne into the bargain.
Now, it must all be distressing. I can appreciate that this is having an effect on you. Have you noticed your general mood changing at all?
Well, it's enough to get anyone down, really. And yes, I do feel a bit depressed. But the frightening thing is that I've started getting mood swings. I've never had them before. I mean, one minute I'm laughing and the next I'm crying, and I don't know why. It's quite alarming.
Anything else?
Well, I confess I feel, well, irritable all the time. Everything seems to get on my nerves, and I can't seem to concentrate like I used to. You know, I find it hard sometimes to do stuff in my head, like working out a sum or remembering names and things. I just hope that you can find out what's wrong with me.
Well, I'm sure we will. Now, I see you've already had some blood tests, but I'll need to do one or two more. You've had a urine test to look at your blood sugar, so I probably won't need to repeat that. We may do a saliva test, depending on the bloods.
OK, I see. And how long will everything take, I mean, before we know what's causing the problems?
Well, I'm afraid it can all take some time, as diagnosis can be quite complicated, and we may need to take...
So, we will go through the answers. So, medical history, they are telling 3 years of corticosteroid treatment that is for asthma. And the general symptoms, the hair on face and a visible hump between the shoulders and excessive and constant sweating. So question number 5, periods are infrequent. The dermatological symptoms, see there, he is speaking about any changes in your skin, they are asking. So tendency to bruise and wounds slow to heal and stretch marks on the thighs. And face appear red in color, dark area on neck. And recent development of acne. In psychological symptoms, see mild depressed, scared by new experience of mood swings. So she's having mood swings, feel constantly irritable. She's always irritable. And recommended test, saliva test, possibly. So we will go through the script. See here, I'll put the audio and you can go through the script also. See.
Good morning, Mrs. Croft. I see your GP has referred you to me.
Yes.
OK. Well, I've got some notes here with his referral letter, but it'd be helpful if you could tell me in your own words the sort of problems you've been experiencing.
OK, well, I've had high blood pressure for several years, but these last few months, that's tending to get worse. I've been on corticosteroids too these last 3 years or so, and that's a result of the fact that I've suffered from asthma since my teens.
I see. But
So the first answer is asthma. She is suffering from asthma and yes, taking the corticosteroid for 3 months. Next one.
I understand you've developed several other problems recently.
Oh, yeah, as you can see, my stomach is huge. I've put on a lot of weight and it seems to be concentrated there. And, oh dear, I don't know what's happened to my face. All this hair which has appeared, it's so embarrassing.
So that is development of hairs or growth of hairs.
And something else which I didn't notice at first, but which other people have pointed out to me, here, see, in between my shoulders, is this, well, I can only describe it as a hump. That really bothers me too.
Yes, I can see.
And look at my ankles, you know, they're swollen too. Something else which has got really bad is that I'm also sweating so much, even in cold weather. No amount of antiperspirant seems to help.
Yeah, that must be difficult. And any aches or pains?
Well, my back tends to ache a bit, but I take ibuprofen, which helps.
Good.
My periods used to be painful in the past, but to be honest, they're so infrequent now that the pain really isn't a problem anymore.
So here we will be confused. See, my periods used to be painful in the past and they are using some contrast expression, but to be honest, they are so infrequent now.
Good morning, Mrs. Croft.
So next. Dermatological
I often
symptoms.
feel tired though. In fact, like really tired.
And what about your skin?
Oh yeah, it seems to bruise at the slightest thing. And I've noticed that if I get a cut or a scratch or something, it takes ages to heal. And something else I've spotted on my thighs, see here is these stretch marks.
Ah, yes.
They're quite noticeable because they're a real purple colour. My face has changed too. I used to have quite pale skin, but as you can see, it's quite red now. And it looks, well, puffy. I mean, it never used to look like that.
OK, so there's been quite a change.
Oh, definitely. And if you look here on my neck, the skin's gone dark. Really odd. I don't know what's happening. And though I never really had it before, I've now got acne into the bargain.
Now, it must all be distressing. I can appreciate that this is having an effect on you. Have you noticed your general mood changing at all?
Well, it's enough to get anyone down, really. And yes, I do feel a bit depressed. But the frightening thing is that I've started getting mood swings. I've never had them before. I mean, one minute I'm laughing and the next I'm crying, and I don't know why. It's quite alarming.
Anything else?
Well, I confess I feel, well, irritable all the time. Everything seems to get on my nerves, and I can't seem to concentrate like I used to. You know, I find it hard sometimes to do stuff in my head, like working out a sum or remembering names and things. I just hope that you can find out what's wrong with me.
Well, I'm sure we will. Now, I see you've already had some blood tests, but I'll need to do one or two more. You've had a urine test to look at your blood sugar, so I probably won't need to repeat that. We may do a saliva test, depending on the bloods.
Okay, I see. And how long will everything take? I mean...
So is it clear? So there are some synonyms or paraphrasing they have used in the test. So here, something else which I did not notice at first, but which other people have pointed out to me for the visible. In the note they have given visible, isn't it? And for the excessive and constant sweating, she is telling, I am always sweating so much. Excessive and constant, that means always sweating. And it seems to bruise, tendency to bruise. And I never really had it before. I have now got acne. So that means recent development. She did not have it before, never really had it before, but now got acne. So recent development. The frightening thing is that I have started getting mood swings. Frightening means scared. I started getting, and I have never had them before, means new experience. Okay. And I feel well irritable all the time and constantly irritable. We may do a saliva test depending on the bloods, possibly. So, while going to the part, there will be some reasons for the incorrect answers. Sometimes the answers will be incomplete answers. That means sometimes in the answer option, they will be speaking about plural form and we will be writing some single limbs. Instead of that, we will be writing limb. And if any like that means that can be they will consider as incomplete answers. And sometimes medications, they will be speaking like medications, but we will be writing it medication. Or so always while writing, we should be careful that. And paraphrased answers. So patient always will be using the informal language, that means layman language, because the patient won't be aware about the medical terms or anything, but the note will be given in the formal language. They will be using the medical format. So the answers, most of the times, answers will be in the note that it will be paraphrased, including words from surrounding notes. And just if eligible, if we are writing, our writing is not clear, that will be, you will be penalized. And if answers are unclear, then more than one answer. Instead of one answer, if you are writing more than one answer, that also considered as a wrong answers. Then while writing answers, only write the words that you hear in the audio. You don't change your word or phrase. Just listen as you, just write the word as you listen. And do not paraphrase the answer. Answer should be legible. Answers must make a grammatical sense. So whenever we write the answers, that should be grammatically correct. Check the spelling of the answers. If there is, sometimes there is minus spelling, they will not be penalized, but there is a possibility of penalized. So always be careful. Do not make any spelling mistakes. Do not repeat the words from the questions. If sometimes they are giving after the filling the blanks, maybe if example, any dose of medication that is they are given after the blank, they have given milligram. Then whenever we write the answers, just write, if it is answer is 30, they are telling like 30 milligram in a tablet or medicines, 30 milligram, just write 30. Don't repeat the word. If it is given in the question or not, if it is given, just write down the number. Don't repeat the word from the question. Anticipation, it is a good skill. If while going to the note, if we can predict, sometimes we can think maybe the answer will be, can be this one. If you can anticipate, it will be a good skill. You can make notes, but cross through them if it is not part of your answers. In the note, in the question paper or the paper, you can make the notes. But if it is not part of the answer, if that is not answer, just put it across or try to erase before you give back the paper. So there are some listening tips. You can listen. You can listen to medical podcasts. It will help to increase your listening, understanding capacity, and concentration. Try to concentrate whenever we listen the audio. Just try to concentrate the audio. Sometimes we will not get the answer. Sometimes you will miss one answer. You heard the answer, but you miss the answer to write. But just don't think about the answers. Just leave it and follow the audio. If you are thinking and sitting about that answer, while you are going back, or means most of the answers will be passed and you won't be able to attend any answer. So just if we are missing one answer, just leave it and follow the audio and try to answer other questions. And while practicing your listening test, just try to practice same audio for at least for 1 week. Just listen the audio carefully and try to take the script of the audio and go through that, understand the meaning and how they are using the modal verbs or contrast words, expressions, and how they are paraphrasing the sentences, how the patient is speaking, what language they are using, and just listen the same audio and go through the go through the script and try to understand the how they are doing the how is the audio and how is the script is giving. So it will be helping you to understand the audios. And the speed, you can adjust the speed and you can try in the different speed format. Sometimes the audio will be a little faster, sometimes it will be going slow. So you can adjust yourself in the speed of the audios and you can listen. And try to be calm while doing the test. Just try to be calm. If you are tensed, you may not be able to attend the exam carefully. So just try to be calm. And efficiently use 30 seconds and 2 minutes. There will be 30 seconds before your audio starts. Just use that 30 seconds. Try to find out the keywords. Try to underline the keywords. And also after the audio, you will be getting 2 minutes to check your answers. So if there is any incomplete answers, just try to complete it. If there is any spelling mistake, just go through that. If there is any spelling mistake, just try to correct it. So we have done. Thank you. Thank you so much.